Hello my dear friends, welcome to F&S Pharma World. So we are discussing competitive examination question paper. We are for the preparation of SBI as well as VSSC or ISRO examination. So in part 4, the next 20 questions are discussed. So let's start. Please do subscribe the channel and express your valuable suggestions and comments. And if you found this useful, please do share it with your pharmacist friends. Let's start. Question number 161. Drugs most commonly used in chronic heart failures are. The drugs that are used for chronic heart failure are option A, cardiac glycosides, B, diuretics, C, angiotensin converting enzyme inhibitors, D, all the above. So answer for this question is option D, all the above. All the above drugs. So that is cardiac glycosides, diuretics, angiotensin converting enzyme inhibitors, all are used for chronic heart failure. Question number 162. Which drug is class 2 antiarrhythmic drug? We know that class 2 antiarrhythmic drugs are beta blockers. So in the option which is beta blocker, option B is the beta blocker, propranolol, which is a non-selective beta blocker. The options are A, flecainide, B, propranolol, C, lidocaine, D, verapamil. Beta blockers, propranolol, esmolol, timolol, metoprolol, etc. are come under class 2 antiarrhythmic drugs. Next question number 163. Which drug is used in treating supraventricular tachycardias? The drug that is used for supraventricular tachycardias, option A, digoxin, B, dobutamine, C, amiodarone, D, dopamine. The drugs that are used for supraventricular tachycardia are digoxin, calcium channel blockers, and or beta blockers. So option A is the correct answer. Question number 164. Duration of nitroglycerin action sublingual is option A, 10 to 30 minutes, option B, 6 to 8 hours, C, 3 to 5 minutes, D, 1.5 to 2 hours. The onset of action of sublingual nitroglycerin is 1 to 5 minutes and the duration of action is 10 to 30 minutes. So option A is the correct answer. Question number 165. Which of the following anti-anginal agent is calcium channel blocker? In the following option, which anti-anginal drug is calcium channel blocker? Option A, nitroglycerin, B, dipyridamole, C, minoxidil, D, nifedipine. Option D is the correct answer. Nifedipine is a calcium channel blocker. Question number 166. This drug reduces blood pressure by acting on vasomotor centers in the CNS. In the following option, which drug reduces blood pressure by acting on vasomotor center? That's the question. Option A, labetalol, B, clonidine, C, enalapril, D, nifedipine. The correct answer for this question is option B, clonidine. Centrally acting antihypertensive drug such as clonidine, it induces peripheral sympatho-inhibition and thereby it causes fall in blood pressure as a result of alpha-2 adrenergic receptor action in the brainstem. So here the correct answer is option B. Question number 167. Pick out the drug, an alpha and beta adrenoreceptor blocker. Option A, labetalol, B, verapamil, C, nifedipine, D, metoprolol. In the following option, which drug is alpha and beta adrenoreceptor blocker? The correct answer is option A, labetalol. Labetalol is a beta blocker with additional alpha blocking property. Option A is the correct answer. Question number 168. Which drug is a directly acting vasodilator? The following option, which drug is directly acting vasodilator? Option A, labetalol, B, clonidine, C, enalapril, D, nifedipine. Option D, nifedipine is the correct answer. Example for directly acting vasodilator are sodium nitroprusside, nitroglycerin, hydralazine, etc. Question number 169. Identify the diuretic agent which is having a potent and rapid effect. The following option, which diuretic have potent and rapid effect? That's the question. Option A, furosemide, B, spironolactone, C, dichlorothiazide, D, indapamide. Correct answer is loop diuretics. Loop diuretics have potent and rapid effect. Option A, furosemide is the correct answer. Question number 170. Choose the positive inotropic drug of non-glycoside structure. Inotropic drug they are asking. The positive inotropic drug with non-glycoside structure. Option A, digitoxin, B, digoxin, C, dobutamine, and D, stropanthine. What's the correct answer? Option C is the correct answer. Dobutamine, it is a potent inotropic drug with and it is a synthetic catecholamine with strong affinity towards beta 1 and beta 2 receptors. So option B is the correct answer. Option C is the correct answer. Question number 171. The following ergot derivative is used for the treatment of acute migraine attack. In the following option, which ergot derivative is used for acute migraine attack? Option A, paracetamol. B, sumatriptan. C, ergotamine. D, metoclopramide. C, ergotamine is the correct answer. It is an ergot alkaloid that is used for migraine attacks. Question number 172. Select an endocrine drug which is a steroidal derivative. The options are option A, gonadrolin. B, insulin. C, levothyroxine. D, hydrocortisone. Steroidal derivative and an endocrine drug. The correct answer is option D, hydrocortisone. Question number 173. Indications of vasopressin are following. Option A, diabetes mellitus. B, hypertension. C, pituitary diabetes insipidus. D, incomplete abortion. The indications of vasopressin are diabetes insipidus. Option C is the correct answer. Question number 174. Which of the following hormone is produced by the thyroid gland? The hormones produced by thyroid gland are triiodothyronine and tetraiodothyrosin. These two hormones are produced by thyroid gland. So option A, thyroid stimulating hormone. B, thyrotropin releasing hormone. C, triiodothyronine. D, thyroglobulin. Option C is the correct answer, triiodothyronine. 75. Which of the following oral hypoglycemic drug stimulates both synthesis and release of insulin from beta islet cells? So both the release as well as synthesis is regulated by which drug? Option A, glibenclamide. B, fenformin. C, buformin. D, metformin. Option A, glibenclamide is the correct answer. It stimulates the synthesis and release of insulin from beta islets of Langerhans's beta islet cells. Question number 176. Which of the following glucocorticoids is a long-acting drug? Following option, which drug is or which glucocorticoid is long-acting? Option A, prednisolone. B, dexamethasone. C, triamcinolone. D, all the above. Actually, dexamethasone is a long-acting drug. Long-acting glucocorticoid. It is potent and its potency is 20 times as that of short-acting. Option B is the correct answer. Question number 177. Which histamine H1 antagonist is noted for serotonin blocking property? Histamine antagonist with serotonin blocking property. Option A, bromophenramine. B, cyproheptadine. C, suprastin. D, dimedrol. The correct answer is cyproheptadine. Option B is the drug with H1 antagonist property as well as serotonin blocking effect. Number 178. Indication for interferon alpha administration is. For what purpose interferon alpha is administered? Option A, hepatitis C virus infection. B, Kaposi's sarcoma. C, condyloma. D, all of the above. Correct answer is all of the above. In all of these purposes, interferon alpha is used. So D is the correct answer. Number 179. Select a fat soluble vitamin. We know that A, D, E, K are fat soluble vitamins. So option A, ascorbic acid. B, tocopherol. C, thiamine. And D, riboflavin. So vitamin B and vitamin C is given in the option B. Option B, tocopherol, which is vitamin E, is the correct answer. A, D, E, K are fat soluble vitamins and option B, tocopherol, which is vitamin E, is the correct answer. Question number 180. Dermatitis, diarrhea and dementia characteristics of. Option A, dry beriberi. B, pyridoxine deficiency. C, scurvy. D, pellagra. Actually, pellagra deficiency leads to dermatitis, diarrhea. Niacin deficiency leads to pellagra, which is characterized by dermatitis, diarrhea and dementia. So, vitamin B3 or niacin deficiency is the reason for pellagra, which leads to the following characteristic features. Option D is the correct answer. So the next 20 questions will be discussed on the next part. For competitive examination preparation for MCQ discussion, please do subscribe the channel. Please share the channel with your friends. Please share the videos with your friends. And please express your valuable suggestions so that I can make changes accordingly. Thank you so much.